Across the country, the U.S. military also risking their lives are on the front lines in this fight against the coronavirus. This pandemic is also taking a toll on service members who risk their own health to help all of us. Defense Secretary Mark Esper joins us now to talk about that part of the story. Good to see you, Mr. Secretary. Thank you so much for taking the time to be with us. We do appreciate that.
Well, good morning, Gail. Thank you for having me.
No, we're very glad you're here. So we're hearing about military healthcare workers that will now be deployed here in New York City to relieve the workers here. Where exactly are they going, and what will they be doing?
Sure, Gail. First, let me say how proud I am of the 50,000 plus American service members who are deployed around the country, helping their fellow Americans. And as you noted, many of them are certainly deployed from their own homes, their own families, but they're also risking their own welfare, their own health to help their fellow Americans. So I'm very proud of them. The Department of Defense, every step of the way, has tried to stay ahead of the curve, ahead of need, and I think we have since going back to January. We've also tried to be very agile and adaptable in terms of how we respond to the state and local governments. I've had several conversations with Governor Cuomo and Mayor de Blasio, and we've been working very well together, and I appreciate the mayor's kind comments in the past couple of days. With regard to the medical professionals in New York City, as you know, we got about 2,500 doctors, nurses, and others in the city. That includes 1,000 on the Comfort, a couple thousand, 1,000 at the Javits Center. And then we've deployed to the 11 New York City hospitals 350 doctors, nurses, and respiratory therapists. And today we'll be deploying another 300 to help those local hospital workers who've been struggling mightily to keep on top of the cases, help them out, provide some additional relief from the Department of Defense.
You know, Mr. Secretary, I hear you say you're proud of them, but it's always interesting to me, they're proud to do it. They want to do this. They want to get out there and help and risk their lives. That's the definition of a true hero to me.
Yeah, they really do. And many of them, if you look at the National Guard, who were the first to deploy, we have over 30,000 now deployed across the United States, and they're coming from those homes and communities. And then as we've had to start reaching into our reserve forces, we've actually had many doctors, nurses, and others just volunteer to come back on active duty or volunteer for active duty to serve. So again, I'm very proud of them. They have my highest respect and regard for what they're doing today across the country.
Well, the biggest outbreak that we're hearing is on the aircraft carrier, the Theodore Roosevelt. There's 1,900 servicemen overall, but 400 are on the aircraft, the Theodore Roosevelt. What steps are being done to protect the servicemen there and in other places?
Yeah, so we have less than 10% of the crew is infected, and all but one are mild to moderate cases. So I think the Navy is taking a lot of prudent steps to get that under control. The most important thing right now is to take care of our sailors, make sure they're getting the care they needed, and then get the ship back to sea so it can perform its wartime mission. And like I said, the Navy's been pushing supplies out there, doctors. We've been able to get thousands of the sailors off the ship and taken care of ashore. And I've spoken with the acting Secretary of the Navy and the Chief of Naval Operations, and I know they're doing everything they can to make sure we accomplish those two missions.
And talking about the acting Navy Secretary, the Bret Crozier resignation has been widely discussed. You have certainly been asked and you have answered. Your thoughts are also widely known. But there does seem to be new information today. The Navy chief says that he appears to be open to reinstating Bret Crozier depending on the outcome of an investigation. Depending on that outcome, are you two open to reinstating him?
Well, look, when I replaced the acting Navy Secretary 3 days ago, I called him and the Chief of Naval Operations into my office. I gave them some guidance. One of the things I told them is this: no further action will be taken against Captain Crozier until the investigation is completed. And once that's completed, we'll see where that takes us. And so we've taken nothing off the table. What I look to do is hear from the chain of command. My inclination is always to support the chain of command and to take their recommendations seriously. So we'll see how that plays out. At some point here in the coming days, they will come to me and share with me their findings and their recommendations.
Is it ever okay to break the chain of command or protocol, this is a career officer, when he thinks lives are at stake? Does that matter? I'm just curious about how it works.
Yeah, so following the chain of command and maintaining operational security is very important in the military. There are always extreme cases where going outside the chain of command makes sense. That's why we want to see where this investigation takes us. But I will tell you, the last time I spoke to the Chief of Naval Operations, We have over 90 ships at sea right now, and none of them have any problems, or no infected crews. So again, I'm confident that overall the Navy is taking prudent steps to maintain the health of our sailors and to ensure our warships are ready to go.
Mr. Secretary, what keeps you up at night when it comes to coronavirus? You've got a lot on your plate. Like everybody who's handling this, I know you're working 24/7. What keeps you up at night on this?
You know, like many governors and mayors have said, the biggest challenge is the medical staff, is making sure you have sufficient doctors and nurses. And then for me, because I have these mobile capability inherent in the military, is to maintain adaptability and be agile. So as the governor first called for building hospital capacity in New York City, the next day I sent the Corps of Engineers, and they began building out the Javits Center. When the governor or the mayor asked for the Mercy ship, we had already been preparing her, anticipating this, so we were able to quickly get her out of maintenance and up into New York City Harbor. And then, of course, as we converted the Javits Center from non-COVID to COVID, we adapted very quickly. And now in the past few days, when I spoke to the mayor about a week ago, he said, I need doctors in my hospitals. I said, Mr. Mayor, we'll get it done. And that's why we began shipping hundreds of doctors and nurses there. So we got to remain flexible and agile. You know, right now it looks like Seattle will release the Army Field Hospital that's up there, 250-bed capacity. We're going to look at another place around the country to send that. Because right now we have forces deployed in New Orleans, Dallas. We're looking at Massachusetts, Chicago, other places around the country that are in need.
All right, Secretary Esper, we see you're on top of it. Flexible, agile, and let's add pivot to that. Pivot's a really big word these days. Thank you, sir, for your time. We really do.
Thank you, Gail. Take care of yourself.